Today we're gonna talk about the digestive system, especially about one of the most important organs of this system, the pancreas. We'll start with a little introduction about the pancreas and then we're gonna talk about the features, functions, about some of the most common disorders in the pancreas, pancreatitis, pancreatic cancer, and diabetes.
Finally, we'll talk about how to keep a healthy pancreas. The pancreas is a gland organ. It is located in the abdomen. It is part of the digestive system and produces insulin and other important enzymes and hormones that help break down foods. The pancreas has an endocrine function because it releases juices directly into the bloodstream, and it has an exocrine function because it releases juices into ducts. Enzymes or digestive juices are secreted by the pancreas into the small intestine. There, it continues breaking down food that has left the stomach. The pancreas also produces the hormone insulin and secretes it into the bloodstream, where it regulates the body's glucose or sugar level. Problems with insulin control can lead to diabetes. Other possible health problems include pancreatitis and pancreatic cancer. The pancreas is an organ 6 to 8 inches long. It extends horizontally across the abdomen. The largest part lays on the right side of the abdomen, where the stomach attaches to the first part of the small intestine, the duodenum. At this point, the partially digested food passes from the stomach into the small intestine, and it mixes with the secretions from the pancreas. The narrow part of the pancreas extends to the left side of the abdomen, next to the spleen. A duct runs the length of the pancreas, and it is joined by several small branches from the glandular tissue. The end of this duct is connected to a similar duct that comes from the liver, which delivers bile to the duodenum. Around 95% of the pancreas is exocrine tissue. It produces pancreatic enzymes to aid digestion. A healthy pancreas makes about 2.2 pints of these enzymes every day. The remaining 5% comprises hundreds of thousands of endocrine cells known as islet of Langerhans. These grape-like cell clusters produce important hormones that regulate pancreatic secretions and control blood sugar.
A healthy pancreas produces chemicals to digest the food we eat. The exocrine tissues secrete a clear, watery, alkaline juice that contains several enzymes. These break down food into small molecules that can be absorbed by the intestine. The enzymes include trypsin and chymotrypsin to digest proteins, amylase to break down carbohydrates, lipase to break down fats into fatty acids and cholesterol. The endocrine portion or islets of Langerhans secrete insulin and other hormones. Pancreatic beta cells release insulin when blood sugar levels rise. Insulin moves glucose from the blood into muscles and other tissues. For use as energy helps the liver absorb glucose, storing it as glycogen in case the body needs energy during stress or exercise. Blood sugar falls. Pancreatic alpha cells release the hormone glucagon. Glucagon causes glycogen to be broken down into glucose in the liver. The glucose then enters the bloodstream, restoring blood sugar levels to normal. The islets of Langerhans are responsible for regulating blood glucose. Too little insulin production will increase the risk of diabetes and blood glucose level will rise. Pancreatitis. Pancreatitis refers to an acute or chronic inflammation of the pancreas. It can lead to secondary diabetes. Pancreatitis can happen as a result of moves, gallstones, trauma, and the use of alcohol, steroids, and drugs. Pancreatic cancer. Cancer can develop in the pancreas. The exact cause is often unknown, but it is often linked to smoking or heavy drinking. Symptoms may not appear until the cancer is in the advanced stages. By then, it may be too late for successful treatment. The prognosis for pancreatic cancer tends to be bad. Treatment usually involves surgery, chemotherapy, radiation, or a combination this. Palliative treatment will focus on reducing the pain. Diabetes. Type 1 diabetes is an autoimmune disease. It occurs when the immune system attacks and destroys the beta cells in the pancreas so that they can no longer produce insulin. The exact cause remains unknown, but it may be due to genetic and environmental factors, including viruses. Type 2 diabetes begins when the body's muscle, fat, and liver cells become unable to process glucose. The pancreas reacts by producing extra insulin, but in time it cannot produce enough insulin. The body can no longer control blood glucose levels.
Following a balanced diet and avoiding smoking and excessive drinking will help keep the pancreas healthy. The National Pancreatic Foundation recommend consuming no more than 20 grams of fat a day, avoiding alcohol, drinking plenty of water to keep hydrated. In conclusion, the pancreas has a vital and very important function to the body. It has a key role in the digestion and glucose control. Some important problems related include diabetes, pancreatitis, and cancer. A healthful diet can contribute to maintaining a healthy pancreas.